Anyone who would start?
What are we up to?
Music therapy, alternative.
Okay. Anybody want to read? In the book, it's page 159.
Very well, I'm happy to start things off. That's
All right,
okay with
thank
everyone?
you. Thank you.
Okay, music therapy. Historically, music therapy dates back to Pythagoras, who taught that singing and playing musical instruments could counteract negative emotions. Today, many hospitals and hospice programs utilize music therapy to reduce anxiety in children, adolescents, and adults. It has been successfully used to communicate with disorientated patients afflicted with Alzheimer's, as well as aiding in the rehabilitation of stroke patients. Music therapy is also used in rehabilitation facilities when working with persons with brain injuries. It has been said to reduce the stress associated with labor and childbirth. In addition, studies conclude that meaningful music can have positive effect on patients suffering from depression and other psychiatric disorders. Many proponents of music therapy suggest that musical sound vibration
Oh, I think Greg froze on us.
Yeah.
Should we wait?
Did you let him know he's frozen?
Yeah, I wonder.
You can text him.
Maybe, what did, okay. Oh, I think he exited and he's gonna re-enter. It's just. Okay, where did he stop? I guess we can start from here. Maybe anyone else would like to continue?
I can continue till he comes back.
Thank you.
Many proponents of music therapy suggest that musical sound vibration, when used for relaxation and healing, affects the brain in such a way as to decrease rapid heart rate, reduce blood pressure, slow breathing, reduce muscle tension, aid in digestion, and induce sleep. In general, music is said to be therapeutically calming when it is slower than the patient's pulse or slower than 60 beats per minute. As Vaishnavas, we understand the importance of transcendental sound vibration to calm the mind and body and to awaken our spiritual consciousness. In a letter I received from His Divine Grace Srila Prabhupada, dated August 29th, 1973, Srila Prabhupada writes, "The chanting of the Hare Krishna mantra is a process of purification. Just like we use soap to cleanse the body, this is material, but the chanting is a spiritual cleansing. The 3 stages of cleansing are first to clean the mirror of the mind. Due to long-term association, the mind absorbed in material things has become contaminated or dirty. The chanting process purifies the mind. The next stage, when the mind is cleansed, one becomes free from the symptoms of material existence. Material existence means to be always hankering and lamenting. I must have a new automobile. I must have more money. I must have a good wife. I must have this. I must have that. Then, when I have the thing, I lament. I have lost my wife. I have lost my money. I have lost my car. Simply lamenting. So the second stage is to be free from this anxiety. The third stage is he never laments nor desires to have anything. He is equally disposed to every living entity. In that state, he attains pure devotional service unto me. Bhagavad Gita as it is, 1854. The next verse continues, and when one is in full consciousness of the Supreme Lord, by such devotion he can enter into the kingdom of God. It is further stated in the Gita that when one is so situated, even in the midst of greatest danger, he is not disturbed. In other words, when one has achieved perfection in chanting the holy name of God, he is always joyful. Even death does not disturb him, what to speak of other things. The conclusion is that one should learn the art of chanting the holy name of Krishna 24 hours a day, and that alone is the remedy for all problems of material existence. So I cannot give you any better advice. Simply chant Hare Krishna and everything will be all right. We have been blessed with this knowledge, and as caregivers, we can give our patients no better music therapy for true peace than the chanting of the Hare Krishna mantra and the many wonderful devotional songs written by the great acharyas. According to the patient's physical and mental condition, as well as his wishes, a soft japa or bhajan tape can be played, or devotees can visit for soft chanting or a quiet bhajan. Depending on how he feels, the patient may desire a more enthusiastic kirtan with mridanga drum and cartels, or perhaps he may prefer to simply chant japa alone or with one or two other devotees. In any case, be sure to give him a choice and to respect his wishes. Facilitating a Vaishnava's Krishna consciousness by providing transcendental music therapy is the greatest service you can render. Jai. Who's next?
Let's see if Greg has come back. I don't see him now. Anyone else would like to continue? Otherwise, Karnapurna Shakti Mataji can continue.
I can try.
Sure, thank you. Aradhana.
Thank you. Aromatherapy. Aromatherapy is the therapeutic use of essential oils extracted from various plants. The flowers, leaves, stem, and roots from noted plants are used to promote relaxation and to provide relief from various mental and physical ailments. Aromatherapy is based on the principle that receptors in the nose convert scents to nerve impulses that are sent to the limbic system of the brain, where memory and mood are controlled. The brain then responds to a particular scent by associating it with past memories. The emotions that are evoked can affect blood pressure, heart rate, respirations, and the release of hormones, neurotransmitters, and endorphins. Even a long forgotten smell can trigger powerful memories, either pleasant or unpleasant. If the scent is unfamiliar, then a new response and memory are created. A scent can be either calming or energizing and stimulating. In addition, some essential oils possess antibacterial, antiseptic, and antiviral properties. In parts of Europe, aromatherapy has been used for many years during labor and delivery, not only to relax the mother, but also to reduce fetal distress and to stabilize fetal heart rate. In fact, aromatherapy coursework is mandatory in midwifery training in Germany. During the past 3 decades, aromatherapy has become more popular in the United States as a complementary treatment that is used alongside traditional medicine. It is often used to relieve stress, anxiety, depression, and insomnia. Proponents use essential oils to help relieve headache, muscle and joint pain, digestive upset, nausea, premenstrual syndrome, some skin disorders, and chest and nasal congestion due to the cold or flu. Oils can be mixed with lotion or a carrier oil for massage, dabbed on a cloth for inhalation, added to bath water, used in vaporizers, placed in a bowl of hot water for steam inhalation, or placed in a basin of warm water for a relaxing foot bath. It is important to purchase essential oils through a reputable company. Often, synthetic perfumes are sold as aromatherapy products using the names perfume oil, botanical perfume, or fragrance oil. Aromatherapy should never be institute it without consulting your patient's physician or hospice nurse. It should never be used as a substitute for appropriate medical care. Use of some essential oils can be toxic to pregnant women or mothers who are breastfeeding. It is contraindicated in patients with conditions such as epilepsy, heart disease, diabetes, kidney or liver disorders, or patients with open wounds. Some essential oils, such as rosemary and eucalyptus, are toxic to infants and children under 5 years of age. It is recommended that a certified aromatherapist be consulted before using essential oils. Some hospice nurses are knowledgeable in this subject and may be able to recommend specific oils that would complement the patient's current medical regimen. Pure essential oils are highly concentrated, and thorough knowledge of their use is vital. Use of pure essential oils differ, but they are also concentrated. That basic guidelines include the following. Do you want me to go through the following? Or do you want, is Greg back?
Greg, Greg, are you back? Let's see. No, I don't see him.
Yeah, it's up to you. I can either
No,
continue or someone else.
you can continue, and then we can pass it on to someone else.
Okay. For massage, dilute 5 drops of oil in 10 milliliters of lotion or carrier oil. Undiluted essential oil should never be applied directly to the skin. Keep oils away from eyes and mouth, but if the oils do come in contact with the patient's eyes, flush the eyes profusely with cool water and consult a medical practitioner if pain or burning persists. For inhalation, place only 1 drop of oil on a tissue or cloth. Place the tissue or cloth near the patient's nose, but not so close as to irritate mucous membranes. For bath, add 6 drops of oil to warm bath water. Assist the patient into the tub and ask her to gently inhale the vapors for 10 to 20 minutes or as tolerated. Please note that hot baths are not recommended during pregnancy or for patients with conditions such as multiple sclerosis, diabetes, or hyper or hypo blood pressure. Always assist your patient when getting out of a tub in case of dizziness or fainting. For vaporizer, fill the vaporizer up with water to 3/4 full and add 4 drops of oil. For foot bath, place 6 drops of oil in a basin of warm water. If the patient is in bed, assist him in bending his knees and place his feet in the basin for a few minutes. Dry the feet immediately after removing them from the water. For steam inhalation, add 8 drops to a bowl of hot water. Position the bowl near the patient so that when a large towel is placed over the patient's upper body and bowl of water, she will be able to inhale the vapors for a few minutes. Caution: if your patient is weak, drowsy, or disoriented, she may require assistance holding her head a sufficient distance away from the hot water so her face is not scalded. In a hospice setting, if it is agreeable with the physician or hospice nurse, any of the above methods of aromatherapy could be helpful for relief of stress and various discomforts. If your patient is bedridden and it is medically appropriate, a warm foot bath or gentle back rub using essential oil in lotion or carrier oil may be comforting. See therapeutic massage for terminally ill patient. Essential oils may be used when giving a bed bath for relaxation and to relieve muscle soreness. I know of some nurses working with patients with Alzheimer's disease who use aromatherapy at the end of the day when the sun is going down. Patients with Alzheimer's tend to exhibit increasing agitation at sundown. This is referred to as sundowner's syndrome. The nurses place a drop of oil meant for relaxation, such as mandarin oil, on a cotton ball. They then attach the cotton ball to the lapel or collar of the patient's dress or jacket with a safety pin. Some disoriented patients think it is a small flower and are pleased to wear it. The cotton ball remains close enough to the patient's nose to provide a calming effect from the scent of the oil. This same principle can be applied in a hospice setting with patients who are experiencing end-stage anxiety. I'll just finish the last paragraph here. The following list of essential oils is not meant to be all-inclusive, but may be helpful if appropriate for your patient's condition. Roman chamomile and lavender, when used as a complementary therapy with other treatments, have shown positive effects in relieving anxiety and generalized discomfort in some cancer patients in a hospice setting.
Thank you, Anna. Kavita has her hand up. Thank you.
Hi, both. Sorry, I'm just I'm using my iPhone and it's so small. Some suggested essential oils, angelica root oil, is extracted from the root, fruit, or seed of the plant. Its uses date back to at least the 14th and 15th centuries during the plagues and was used to ward off infection. It has a musky, pepper-like scent and is said to make a good expectorant, aid in digestion, relieve muscle discomfort, and help relieve coughs and colds. It is known to be a relaxant. Angelica root oil can be mixed in carrier oil for massage, placed in bath for relaxation and to reduce muscle tension, placed in a bowl of hot water and its vapors inhaled to relieve congestion from a cough or cold, or placed on a warm cloth and used as a compress. A drop of angelica root oil on a tissue can help clear nasal congestion due to a cold. Caution, avoid sunlight after use, or it may cause skin irritation. This oil is not to be used during pregnancy. Avocado oil is extracted from the fruit of the tree. It is used for treating skin conditions such as eczema and sunburn. It may be helpful to patients with dry skin. It is used as a base or carrier oil for massage. Basil oil is extracted from the flowering sweet basil plant. It is used for anxiety, insomnia, fatigue, headache, poor circulation, and muscle aches. Basil oil can be mixed in carrier oil or lotion for massage, placed in a bath to increase circulation and relieve aching muscles, or added to a bowl of hot water for inhalation. This oil can be dabbed on a tissue for inhalation or on a compress placed on the forehead to relieve a headache. Caution, basil oil is extremely potent and may cause skin irritation. It should never be used during pregnancy. Clove oil is extracted by steam distillation from the flowers. It is known for its antiseptic properties and also makes a good mosquito repellent. Clove oil is sometimes used in mouthwash. It has been traditionally used to relieve toothaches by rubbing the oil on gums. This oil has a spicy, stimulating scent, but can also be warming and relaxing. In aromatherapy, it is helpful with generalized aches and pains and back pain and is used as a muscle relaxant. It can be used for massage or in a warm bath to soothe and relax. Caution, clove oil must be well diluted or skin irritation may occur. It should never be used during pregnancy. Eucalyptus oil is extracted from the twigs and leaves of the blue gum tree. Historically, Aborigines crushed the leaves of the tree to heal wounds and fight infections. Today, eucalyptus oil is used in many cough and cold remedies and is helpful as a decongestant and expectorant. It has antiseptic properties that kill airborne germs. It is used to relieve some symptoms of cold, flu, or sinus infection and has been helpful in reducing nausea. When diluted properly, the essential oil also soothes muscle aches and aids in healing skin abrasions. It can be used for massage in a soothing bath, as inhalation therapy when diluted in a bowl of hot water, and used as a decongestant dabbed on a warm compress and placed on the chest to clear congestion, and diluted in water as a disinfectant when cleansing the patient's room. This oil is very strong and should be diluted well. Lavender oil is extracted from the leaves of the evergreen shrub and is often used to decrease tension, fatigue, and depression. It is helpful with some skin problems in relieving generalized aches and pains and has anti-inflammatory and antibacterial properties. It can relieve a headache, a toothache, and soothe stomach discomfort. Lavender oil is used for massage, warm baths, inhalation therapy, and compresses. When a few drops of lavender oil are placed in a hot bath, it produces drowsiness and decreased anxiety and stress. When placed in a cool bath, this oil refreshes and energizes and produces a feeling of well-being. Should I stop there, Prabhu?
We can ask if there's anyone else who would like to read, or otherwise you can continue. Anyone else would like to continue? Sure, why don't you go ahead? Thank you.
Okay. Mandarin oil is extracted from the peel of the ripe fruit of the citrus tree. In aromatherapy, it is used as a sedative and can help relieve headaches. It is also used as a digestive stimulant. It has relaxing effect and can decrease stress, restlessness, and nervous tension. It can be helpful when a patient is feeling irritable. This oil is used for massage, baths, inhalation therapy, or can be dabbed on a tissue to decrease anxiety. Caution, this oil should be used in moderation or it can cause skin irritation. Some patients experience photosensitivity, sensitivity to the sun or other ultraviolet light source, and after use should be cautioned to stay out of the sun immediately after use of this oil. Peppermint oil is extracted from fresh or semi-dried leaves and flowers of the herb. Historically, it has been found in Egyptian tombs dating back to 1000 BC. It has long been known for its antibacterial, antiviral properties. Today, peppermint oil is used to invigorate, refresh, and cool. It is used to relieve headaches, mental fatigue, muscle aches, and nausea. It is also used to stimulate digestion. A few drops diluted in warm water can provide a refreshing foot bath for your patient. Peppermint oil is diluted and used for massage, baths, inhalation therapy. I lost my place. And compresses. A drop of oil on a tissue may relieve nausea. Caution, peppermint oil is very potent and should be used in moderation. Dilute carefully since it can act as a stimulant. It should never be used before going to sleep. Sandalwood Mysore oil is extracted from the roots and wood of the tree. Most sandalwood essential oils comes from India. This oil is an antiseptic and is used as an astringent. It has a sedative effect and therefore helpful in reducing stress, tension, insomnia, and depression. It is often used as an expectorant for coughs, colds, or diluted in carrier oil and used as a moisturizer for dry skin. Diluted oil can be used for massage, baths, inhalation therapy for relief of congestion, and compresses to reduce anxiety and soothing aching muscles and joints. Roman chamomile oil is extracted from freshly dried flowers. The essential oil contains azulene, a natural anti-inflammatory. It is used for stress, insomnia, headaches, skin rashes, burns, cuts, insect bites, toothaches, menstrual and menopausal ailments. It is used for massage, baths, inhalation therapy, and compresses for headaches and menstrual discomfort. Haribo. Should I finish this? I can finish this geranium oil.
Sure, thank you.
It is extracted from the flowers, stalks, and leaves of the shrub. It has a sweet mint-like scent that is used as a sedative. Geranium oil has antiviral and antifungal properties. It is diluted with carrier oil or lotion to relieve flaky, dry skin. It can be used in massage baths, inhalation therapy, or compresses. In a hot bath, this oil is relaxing. In cool water, it is stimulating and energizing. For thousands of years, essential oils have been used to soothe the mind, body, and spirit. As previously stated, The above list is not meant to be all-inclusive. There are many more essential oils that may be appropriate for your hospice patient, and research into their healing properties may be of value. Haribol.
Thank you. That was wonderful.
Is there anyone else who would like to continue reading?
Horrible. I can try again. Hopefully it won't kick me off this time.
Oh, I'm sorry. I've been
Yeah.
noticing you
I,
keep logging in and out.
yeah, I don't know what happened, so apologies. But yeah, I'm
Oh, no
happy
problem.
to continue. So hopefully it stays. Okay.
Yes, no problem.
Herbal therapy. Following a list of some of the more popular herbs, along with the usages and cautions, there are many healing herbs for a variety of symptoms. Neither the list of herbs nor the usages stated for each are intended to be all-inclusive. Please remember that even natural remedies can have negative effects or toxic levels if taken incorrectly or in the wrong combination. They can also have adverse interactions with allopathic medications or other medical therapies your patient may be using. Further, current laws in the United States allow herbal products to be regulated as if they were food and not medications. Therefore, the Food and Drug Administration, FDA, cannot apply the same standards for their production as with prescriptions or over-the-counter medicines. Always consult with a licensed herbalist for correct dosages and with your patient's medical doctor before starting any herbal therapy. Please be aware that many herbal tinctures are made with alcohol to extract the medicinal ingredients and to act as a preservative. One more word of caution: although this is a book for the care of hospice patients, I would like to mention, for the sake of other readers, that many herbs are contraindicated during pregnancy due to their stimulating effect on the uterus. If an incorrect herb is taken at this time, it could cause premature delivery, which could cause a host of complications for the newborn. Cranberry. Also called Vaccinium macrocarpon, this herb is useful in fighting urinary tract infections. The berry part of the shrub is used and comes in capsule or juice form. It is sometimes difficult to purchase 100% pure cranberry juice, as it is often mixed with other fruit juices, water, and sugar. There are no adverse reactions reported concerning this commonly used herb. Echinacea. Native Americans originally used echinacea, also known as purple coneflower, for fevers, snake bites, and wounds. Over the last 50 years, echinacea has become well known for its antibacterial, antiviral, and antifungal properties. It is frequently used for colds, flu, and upper respiratory infections. It can also be used as a wash for infected wounds and as a gargle for sore throats. Part of the plant most commonly used is the root, which can be powdered and placed into capsules. High dosages may cause dizziness and nausea. There are also controversial findings that echinacea may exacerbate certain conditions such as HIV, AIDS, tuberculosis, and multiple sclerosis. Echinacea should not be taken with drugs that are toxic to the liver, such as some steroids, e.g. amiodarone, methotrexate, and ketoconazole. As usage of this herb, even if taken alone for more than 8 weeks, could cause hepatotoxicity, liver toxicity. Feverfew. Feverfew, also known as featherfew, has a long history of use for fever reduction and nausea. It was also applied externally for headaches. Recently, feverfew has become popular for the management and prevention of migraine headaches. It is believed that it may also lower blood pressure as well as ease pain of chronic inflammation, as in arthritis. Aerial, above ground parts of the feverfew plant are used. The fresh leaves can be used to make an infusion, placing leaves in a container, pouring hot water over them and steeping for 10 minutes, or the leaves and flowers may be dried and put into capsules. Because feverfew decreases blood clotting, it should not be taken after surgery or used by patients who are on blood-thinning drugs, such as aspirin. Chewing the fresh leaves may cause mouth ulcers. If more than the recommended dose is taken, this herb could cause gastrointestinal upset or nervousness. Feverfew is contraindicated in patients allergic to ragweed. Ginkgo biloba. The ginkgo tree is also known as the maidenhair tree. Ginkgo is used for circulatory diseases and in particular for improving blood flow to the brain. This herb is said to benefit some patients with Alzheimer's disease, atherosclerosis, hardening or narrowing of the arteries, stroke, congestive heart failure, depression, diabetes, and multiple sclerosis. It has also been used for varicose veins, hemorrhoids, leg ulcers, tinnitus, and headaches caused by constriction of blood vessels. Fresh leaves from the ginkgo tree are used for fluid extracts, a commercial product made to pharmaceutical specifications with increased strength of herbal mixture, tinctures and infusions, or the dried leaves for capsules. The seeds are used for decoctions. Taking more than the stated dose can lead to headaches, skin disorders, or stomach upsets. Ginkgo should not be taken with anti-clotting medications, as this herb may inhibit blood clotting and cause bleeding. Ginseng roots. Ginseng is a slow-growing plant that has been widely used in China for 5,000 years. The genus name Penax is Greek and literally means cure all. Historically, this root has been used as an aid during convalescence, to build resistance to illness, and to promote health and longevity. The use of multivitamins in the West is somewhat equivalent to the traditional use of ginseng root in Asia. There are 3 types of ginseng: Asian, the most well-known, Siberian, and American. Ginseng is amongst the most studied of all medicinal herbs and is used for combating exhaustion, increasing concentration, stimulating the immune system, regulating levels of blood sugar and cholesterol, decreasing depression, and enhancing mood. Particular illnesses this herb might help include Alzheimer's, atherosclerosis, chronic fatigue syndrome, and flu. The root of the ginseng plant is used for medicinal purposes. The whole root is often used for decoctions or tinctures, or it is powdered and used in tablets or capsules. Ginseng should be avoided by people with high blood pressure and should not be taken with stimulants such as caffeine. The World Health Organization has cited 2 cases of adverse interactions between ginseng and MAO inhibitor, phenelzine nardil. Because it can thin blood, it should not be taken with cardiac medication or with medications for diabetes. Ginseng should also be avoided by anyone who is pregnant, as it could adversely affect the fetus. In rare occurrences, it has caused overstimulation and insomnia. Golden seal. Golden seal, or Hydrastis canadensis, was traditionally used by Native Americans for a variety of ailments, including indigestion, fever, whooping cough, liver or heart problems, and gastric disorders. Today, golden seal is often used for colds and flu, especially in combination with echinacea. It is also said to strengthen the immune system, promote the functioning capacity of many of the body's organs, and act as an antibacterial and antiviral agent. Diluted, it is sometimes used as an eye wash for conjunctivitis or as a mouthwash and gargle for gum disease, mouth ulcers, and sore throats. Patients with high blood pressure should not take golden seal. In addition, this herb may decrease the effects of anti-clotting medications. Eating the fresh plant can cause mouth ulcers, and high doses of golden seal can cause gastrointestinal distress. Kava kava. Kava kava or Piper methysticum is a member of the pepper family and a popular herb in the South Pacific. It is used there for ceremonial purposes, including welcoming important guests. This herb is most widely known for its relaxing qualities and is often used to reduce stress, restlessness, and nervous anxiety. Kava kava is also used as a muscle relaxant and for some of the symptoms associated with menopause, such as depressive moods, irritability, and hot flushes. Continuous and/or large doses of this herb can cause a temporary yellow coloring of the hair, skin, and nails. A few rare cases of allergic skin reactions have been noted. Patients who are taking barbiturates, antidepressants, or anti-anxiety medications should not take kava kava as it can increase their effects. This herb increases sedation and when taken in combination with these medications can lead to coma. Shall I continue? How are we doing for time?
Yeah, we have a few more minutes.
Yeah.
Continue. Thank you.
Okay, no problem. Licorice root or Glyceres glabra has been therapeutically used for thousands of years, both in the West and in the East, for a variety of symptoms. The ancient Greeks used licorice root as an expectorant, and it has been used in traditional Chinese medicine as an antiarrhythmic in cardiac patients. Much research has been done on this root and is widely used both medicinally and for flavoring. Licorice is used for lowering blood cholesterol. In addition, it soothes gastric and duodenal ulcers, chronic gastritis, epigastric bloating, and the pain in rheumatism and arthritis. It is still used as an expectorant and as an anti-inflammatory agent. Licorice has also been used for herpes simplex, hypoglycemia, indigestion, some infections, and menopausal symptoms. Patients with high blood pressure should avoid the use of licorice because it can cause sodium and fluid retention. It is also contraindicated with severe kidney insufficiency, liver disorders, hypokalemia, low potassium levels, and tachycardia, rapid heart rate. Licorice should not be taken with certain diuretics because it can further potassium loss. Increased sensitivity to the cardiac medication digitalis can occur when combined with this herb. Toxic effects from overdose of licorice root may include weakness and lethargy, dulled reflexes, and high blood pressure. Psyllium seed. Blonde psyllium seed obtained from Plantago ovata is native to Iran and India. Black psyllium seed obtained from Plantago afra is native to Western Asia, Northern Africa, and the Western Mediterranean area. Both are now extensively cultivated in other countries. Psyllium is widely used for chronic constipation, irritable bowel syndrome, and increased cholesterol. This herb should not be used by patients who have stenosis, narrowing of the gastrointestinal tract, bowel obstruction, or poorly controlled diabetes. Absorption of other medications taken at the same time may be delayed. St. John's wort. Medicinal use of St. John's wort, or Hypericum perforatum, dates back to ancient Greece, where it was documented by herbalists for its therapeutic applications as a diuretic for the treatment of neuralgic conditions, nerve pain. Today's St. John's wort is most widely known for its antidepressant properties. It's also used to treat anxiety. Applied externally, this herb has been used to treat sprains, bruises, and wounds because of its anti-inflammatory effects. Aerial parts of the St. John's wort plant are used. The leaves, stems, and flowers are used for infusions, tinctures, and washes. Infusion or dilated tinctures used to bathe wounds, ulcers, or other skin conditions. The flowering tops are used to make infused oil, active plant ingredients extracted in oil, and cream, which are used externally. It is generally believed that St. John's wort should not be taken with MAO inhibitor antidepressants. If higher than recommended doses are taken, this herb can cause photosensitivity, especially in fair-skinned individuals. Rash, severe burning, and skin blisters have been reported in those with photosensitivity. According to how it is processed, this herb may sometimes inhibit iron absorption.
I think we can just finish with valerian root, and then next week
Oh,
heat and cold.
okay. Valerian root, or Valeriana officinalis, has been used for at least 2,000 years. It is responsible, but its responsible components and their modes of action are not completely understood. Sometimes referred to as nature's tranquilizer, it is now primarily used to relieve nervous tension, anxiety, and insomnia. It's also used for healing wounds and ulcers, digestive problems, and dysmenorrhea, painful menstruation. It can be topically applied for muscle cramps. Valerian can be used alone, but is often combined in a tea with other herbs for relaxation. The roots of valerian plant are used to make infusion, tinctures, maceration, the process of softening by soaking the herbs in cool fluid, soaks, compress soaks, and washes. It is recommended that valerian not be taken for more than 2 or 3 weeks without a break, as it may cause headaches and/or heart palpitations. This herb should not be taken with barbiturates, sleep-inducing drugs, certain antidepressants, and antihistamines, as it increases drowsiness.
Thank you so much. Great reading. Thank you, everyone. We've gone through quite a lot. We'll continue next week we'll finish off this chapter and get into the care for the caregiver next week.
Can I just say something about this chapter? If you're taking care of a family member, a friend, or a devotee in the community, and you'd like to add, an herbal tea or one of these alternative or complementary treatments, always check with the hospice nurse or the hospice physician if he or she comes to the home. Always call the hospice and double check and make sure it's okay. Even if it's an herbal tea, well, it's just an herbal tea. You buy it at the grocery store or the health food store. What's the big deal? You'd be surprised how even an herb can be contraindicated with a medication that they could be taking. So always check before you start something, even over the counter. Okay, please. Just, it's always better to check and be sure than to give them something and have a reaction in the patient. Okay, thank you.
Thank you so much, everyone.
Wonderful. Thanks, everybody.
We'll see you next week.
Thank
Okay,
you.
have a
Hare
good week.
Thank
Hare
you.
Krishna, everybody. Hare
Hare
Bol.
Krishna.
Krishna.
You.
Keep
Safa.
warm.
Great week. Hare
Hare
Krishna.
Krishna. Thank
Hare
you so
Krishna,
much.
everybody. Thank you.
Hare God.
Haribo.